Today I want to talk about a very confusing topic for a lot of bariatric patients, and that is a very important topic that has a lot of mystery and confusion around it, and that is a hiatal hernia. First thing, what is a hiatal hernia? Well, it's a very important topic for bariatric surgeons because a hiatal hernia is not the kind of hernia that most people think about. It's not the kind of hernia that you can see on someone. In fact, the only way you can really tell if you have a hiatal hernia is by having imaging like CAT scans or x-rays done, or having an endoscopy by putting a camera in your mouth. So let's talk about what a hiatal hernia is, why it's important, and why we as bariatric surgeons are very cautious about it. So here's your basic anatomy. When you eat food, food goes down in this top part of your stomach, which is a connection here of the esophagus to the stomach. So food goes down here, this is your stomach, and exits out your small intestines here. A hiatal hernia involves this top part of the stomach here, and you can think of this yellow part like the hiatus or the diaphragm. There are muscles that open up in the patient's diaphragm that kind of create an opening between the esophagus and the stomach. What a hiatal hernia is where you have this opening be too big, and this top part of the stomach can actually herniate through. And there's many different kinds of hernias depending on how much stomach or what goes in the chest. So to give you a better understanding, the stomach should be here. In a hiatal hernia, that stomach has herniated up and has gone higher out of the abdominal cavity into the thoracic cavity. So why is this important? Well, imagine your surgeon's trying to go in to perform surgery on your actual stomach, and when they get in, they find that whole stomach is in the wrong spot. So it's very important, especially in weight loss surgery, to be able to reduce this hernia, put the stomach back in, and usually we perform a surgery called a hiatal hernia repair, where the muscles that are loose get tightened here so that hernia stays where it should be. If we don't take care of this hiatal hernia, a lot of times it can lead to problems such as acid reflux, swallowing, and that can be a big problem in a bariatric patient. So this is what a hiatal hernia is. It's very important that we understand the anatomy. Thank you guys for watching. If you liked the video, please share it. If you have any other topics you want me to talk about to try to break down to make it simpler, I'll be happy to. Leave it in the comments. Thanks again.